Thanks, Katie. So we are recording the session. So there are actually quite a few people who will be joining us a little bit later and who couldn't join us. So it will be made available. This is set up as a meeting, so you will be able to interact. But what we would like to do now is to mute to everyone so that we can do the presentation and hold questions till the end. And so if you do have questions, feel free to put them in the chat and we will definitely get them after the presentation. So I am Jenifer Trachtman, and I have been directing the Monell Anosmia project for ever since we launched, which is exactly 7 years tomorrow. So the reason we're here today is because this is Anosmia Awareness Week, in essence, which is really punctuated tomorrow on Anosmia Awareness Day. So a lot has happened in the last 7 years since Monell got started down this road. And there are really two things I wanted to point out that are so terribly important. First of all, awareness. It may have taken us a pandemic, but the sense of smell has really finally arrived. It is now at this very critical tipping point where the world cares about it and what happens when you lose it. And I think the second really critical thing that's happened over these last years is that we have much more of an appetite for supporting smell loss research. And in fact, Monell announced this week that we had just crossed the $1 million mark. We've raised $1 million in private contributions to support smell loss research. So many, many thanks for that. And really, when we boil it down, there are two ways for us to get to future treatments, and those are going to be more awareness and more research. And so I think, these first 7 years have been enormously productive. And I had to pause here for a moment and thank John Hickey. He has been really terribly important to get us to this day. He is the individual who came to us about 8 years ago, before I was even at Monell, very passionately with his personal story about smell loss. And a promise to give us some seed money to get some research off the ground. And the very important thing about John is that from the very beginning, he asked us not only to do research, but to build awareness. And so I really can't thank John enough, and his wife, Terry. They've both been enormous, wonderful cheerleaders setting the stage. So, building on John's vision, the focus today is on awareness and advocacy, and in particular, patient associations. And so we're hosting this event now, as I said, during Anosmia Awareness Week. And we're hosting this because we at Monell are researchers, and we're very good at what we do, but we don't have a personal story about smell loss. And so we have been supporting a group of individuals who have those personal stories as they develop as advocates and educators. And so with that, I want to introduce STANA, the Smell and Taste Association of North America. STANA is, as far as we know, the first taste and smell disorders patient association to emerge in North America. And I would like to believe that STANA began in 2018 when Monell co-hosted a conference. I know Joel is on the call, that Joel was one of the main organizers of. That's when I first met Katie Boateng and Marj Rosner. And Katie had just moved to the East Coast. She had already started hosting the Smell podcast, which you'll hear a little bit more about later. And Marj had very recently lost her sense of smell. She came gangbusters into the conference. She had read all the research, and it was clear that she wasn't going to stop reading until she got some answers. And then last fall, we all met Pamela Silberman, and she fit right in for two primary reasons. One, she is the daughter of an ENT from Philadelphia, and she has a background in strategic communications. And so the three of them have really coalesced to become STANA. And we're really delighted to be a part of that association. And I want to hand it over now to Katie Boateng, who is going to start us off. So Katie.
Yes, thank you guys. Thank you everyone for joining us today. We're very excited to be with you today as STANA, the Smell and Taste Association of North America, and really kind of dive into a little bit more who we are. So to start off, a little bit of introductions. You probably are very familiar with a lot of these people on the slides, but we've been partnering with some founding strategic advisors to help us get started. So Nancy Rawson is the Vice President and Associate Director at the Monell Chemical Senses Center, so I'm sure a lot of you know her. In addition, Jenifer Trachtman has been on board with us over the last really 12 months with this process, and she again is the Director of Development at the Monell Center. We also have Polly Joseph, who's been integral to the team as well, and Polly works for the National Institutes of Health. In addition, both Nancy and Polly, I believe, are members of the Global Consortium for Chemosensory Research, or GCCR. And I know that Polly serves on their leadership team and their Diversity and Equity Committee. Next up, we're actually going to be diving a little bit into more of who we are as individuals, the founding patient members. So I'll obviously start off with myself. So my name's Katie Boateng. I'm originally from a small town outside the capital of Boise, Idaho. As Jenifer mentioned, my husband and I moved to the East Coast back in 2018, and currently I'm living in New Jersey, which is very different than what's depicted on the Jersey Shore TV show. So I was surprised when I moved here to learn that it's not exactly what is online or what is portrayed on TV. So my own anosmia story is that I actually became an acquired anosmic due to a post-viral upper respiratory infection back in late 2008, early 2009. And so really what happened was that I was in my first year of college. I was hanging out eating breakfast one morning that spring of 2009, and I had been really sick over the winter previously. I realized sitting there that I couldn't smell the spray, like the bleach cleaning spray that my roommate was spraying on the table. And that was obviously very concerning for me because I wasn't sick anymore. So at that point, I went back to my hometown, my family doctor, and had a conversation with him about what was going on. And he did some things with me, prescribed some treatments that didn't help the situation. After that, he referred me on to an ear, nose, and throat specialist up in the capital of Boise, because like I said, I'm from a very small town, so I got to drive up to the big city to go and see an ENT. So when I went and I did that, again, ruled out any kind of polyps or things like that that could be causing the problem. I was then referred on to a neurologist who ruled out any kind of brain issues for me, which is great. All of those things are really good news. But what that really left me with was, we don't really know why you don't have a sense of smell anymore. The best guess is that it's due to this sickness that you had over the winter. And so the best guess, as I say, is that I have post-viral anosmia. And that's never been formally diagnosed. Like, that's not written down anywhere that that's my diagnosis, but that's what we think happened to me. So back at that time, when I was done going to the doctors, done going to see the specialists and things like that, that was really it. So I was kind of just like, all right, well, now what do I do? So it was 2009-ish. Facebook was a thing, obviously, but it wasn't as big of a deal as it is now. And there weren't a lot of organizations that I found online or support groups on Facebook like there are today. So I kind of just moved on with my life and dealt with having anosmia. For a long time, I didn't really think about it. So Jenifer mentioned my husband and I moved here to New Jersey back in 2018, and I was job hunting at the time and had some extra time while I was looking for jobs. And I decided that I wanted to create a podcast about having anosmia. And so I created what is called the Smell Podcast. Many of you may already be familiar with it. If not, it is a podcast that was created to share listener stories, scientific research, and just interesting news about the world of smell. I've actually done a few episodes with people from the Monell Center, including Dr. Danny Reed, about the formation of the GCCR. I've spoken with Dr. Federica Genovese about her research on the trigeminal nerve. And then in addition, Dr. Beverly Cowart about her work with Monell and the future of smell research. So all of those episodes are out there and are super great. And really, the impetus to start this podcast was because I wanted people to not be alone. That's what I would have needed back in 2009. And it's really grown since then. It's been a fantastic experience for me. So moving on, in my day-to-day life, I work full-time in undergraduate admissions at a university. So that's what I do for my day job. I'm also a part of the Global Consortium for Chemosensory Research's Patient Advocacy Committee since last April, right when the pandemic really got going. And in addition, a Fifth Sense ambassador. So there's a few people from Fifth Sense here on the line today. And I have been serving as a Fifth Sense ambassador for them since last August. But I think most importantly is my new role as a founding member of STANA. So next up, I'm going to pass it along to Marj to let her introduce herself.
Good morning. Thank you for letting us come and speak with you. I'm Marj Rosner, and I was born and raised in Detroit. Came to Washington fresh out of graduate school, thinking that I was going to make a difference in some major kind of way. Took me a few years to have the reality kicked into me, but at that point, I actually ended up in a corporate real estate capacity, and I work for a brokerage in Washington, D.C., which is where I live. I live in Chevy Chase, Maryland, but I work and live in, generally speaking, Washington metro area. I'm the new kid on the block in terms of my condition. As a kid, let me just back up for a minute. As a kid, I had upper respiratory infections all the time. I had asthma. I had pneumonia numerous times in the winter. The winters in Michigan, if you think about it, are kind of brutal. And I've never been a lover of snow, but it was predictable that in the winter I would get sick. And as a kid, when I got sick, when I got viral infections, I always lost my sense of smell. And it wasn't like the stuffiness of a cold when you can't smell. It was a smell loss. I was aware of it, but it always came back. So I never really panicked about it. I can remember eating spaghetti and not being able to taste it for about a week. And then a week later, it was back. So it just wasn't an issue for me. And then in May of 2018, I got a pretty bad virus. My doctor said that it was a SARS virus. And I was really, really, really sick for about 3.5 weeks. And as I was getting better, of course, my semi-expected absence of smell and taste set in. But this time it didn't go away. And after about a month, I decided I might want to find out about it. I have a regular ENT, went to him, and he did all of the normal checking and testing and gave me the scratch and smell test, which I failed miserably. Don't like failing tests, but anyway. So he gave me a course of steroids and did all of the sort of traditional things to help, and basically said to me, these are the things we do. And the hope is that they will work. But if they don't, that's it. You have a condition called anosmia, and you might well want to just learn to live with it. And he's a good guy. He's not a sort of a flippant doctor. I think some people have had these horrible experiences with doctors who are very, very dismissive. But in the end, I mean, he was kindly dismissive. He just didn't have any other answers for me. That was the point at which I panicked. And being sort of obsessive, I just decided that this was going to become my new hobby. I was going to find out everything there was to know about anosmia. And using Google as my best friend, I just dove into things and read every single piece of research I could find. Read research I had no understanding of whatsoever. But I thought that, the more I read, there are little pieces of it that are sort of going to jump out at me, and I'm just going to get more information. And along the way, I stumbled on Chrissy Kelly, who formed Absent and who is a remarkable human. I think she's just wonderful. And she was extremely kind to me. She sort of took me under her wing and gave me some ideas, gave me some hope, some strategies for coping with things. I started doing her smell training, which I think she got from Dr. Hummel, but she sort of enhanced it and developed it as her own thing. And so I started doing that. I think it's helped a little over time. I have some minimal smell. For unknown reasons, I can smell rice cooking. And that seems like a very odd thing, but I can tell you, I can smell it and it smells like rice. So anyway, so I just moved along from there, but haven't stopped doing research. And Chrissy got me to Monell. And I reached out. Jenifer responded to me. Chrissy had told me that there was a conference in November of 2018, and I just decided that I would go. And I showed up. It was a horrible, horrible 2 days of weather. That's one of the things I remember vividly about it. But once we got inside, the people were wonderful and they were helpful. And a little bit like Katie mentioned, I felt like I found a community. I knew no one in Washington who had the condition. And so meeting these people, talking to people, discovering people who had similar kinds of issues was so, so reassuring. One very small anecdote. Cucumbers are benign under normal circumstances. There are many people with anosmia who find cucumbers to be disgusting. And it was really interesting to me to meet people who had, as we were comparing food groups that just were bitter and ugly, horrible, the cucumbers was a common thread. So, I mean, those are just the kinds of little things that really did help. So anyway, when Jenifer reached out to me and said, we're thinking about doing this, forming this organization, I felt like this was something I just had to do. And so the three of us got together, and this is happening with lots of help from lots of other people. So that's kind of my beginning story. And now I'm going to turn it over to Pamela.
Oops, thanks, Marge. Hold on. Okay, thank you. Thank you for having us today and for giving us a space for this conversation. I'm Pamela Silberman. I'm originally from Philadelphia. For the Monellians in the Philadelphia area, I grew up in Abington and I earned my undergraduate degree at the University of Pennsylvania. Have never lost my love for Philadelphia sports teams. But I've moved around the country for work opportunities and for graduate school, and ended up settling in the Washington, D.C. area where I live now. Professionally, I'm a consultant to investment firms. I advise them on capital raising, investor relations, and marketing to institutional investors. I became anosmic in late 2008, early 2009 due to a sinus infection. And I've been fortunate to be a pretty healthy person throughout my life. And so having a sinus infection that was so bad that I had to go to an ENT was kind of rare for me. And after treatment of antibiotics, the infection cleared and I realized I still could not smell. So the doctor definitely had me do all sort of the neurological tests and scans and ruled that out, and then recommended that I go to the taste and smell clinic in DC, where I was a patient for some time and treated. I followed their protocols, but had no improvement. I left their care and went to the Taste and Smell Center at the University of Pennsylvania, where I was evaluated. And unfortunately, Dr. Doty informed me that my smell loss was probably permanent. I continued to look for help. That's a pretty devastating thing to hear. But I was, looking for solutions. I was looking for treatments and really assistance on like how to live a life without smell. I did have some scary experiences. I had gas leaks in my home. I now have detectors throughout. But there is the emotional, mental, and physical adjustment to life without smell. I did start following Monell's research, and that gave me some answers, and it also gave me a lot of hope. And when Monell connected me with other anosmics, like Katie and Marge, I felt I'd found a community of people who, understood what I was going through and some of my fears and concerns and frustrations. And so I was really excited to get on board and help with the formation of STANA. And I'm also pleased to be officially joining Monell's International Advisory Council to serve as a representative of the patient experience. Jenifer also mentioned that I'm the daughter of a otolaryngologist, and my dad was passionate about his work and his patients. I even worked side by side with him and his partners a couple of summers when I worked at his office during high school and college. And from that experience, I do recall learning that people, suffered from smell loss, although I don't recall knowing that it was permanent. And I definitely associated it with allergy sufferers because they often, being the longtime sufferers of allergy, they would tell stories and sitting in my father's office about, experiencing smell and taste dysfunction and how it would come and go. The other thing that I learned from my father was his drive to pursue innovative solutions and medical and scientific treatments, and really to treat the whole patient. He had an incredible bedside manner and just kind of known for his sense of humor. So I see my efforts at STANA, really as a continuation of his legacy to solve problems and just find answers for patients. And I'll turn it to Katie.
So thank you to everyone for introducing yourselves, and hopefully that helps everyone on the call get a better sense of who we are as a group. So our vision with STANA is outlined here, but when we started meeting as a group, we were actually very mindful when picking out the name that we wanted it to include both smell and taste. So originally I thought to myself, like, let's do an anosmia patient association. And then as a group, we really talked about that and thought that, yes, obviously anosmia is an important piece and something that impacts all three of us directly, but there's more to smell disorders than just anosmia. So that's part of the conversation that we had as we were getting going. In addition to that, as we established as a patient organization, we wanted to make sure that we were inclusive of North America versus just the United States of America. So one of our future goals is for us to establish in both Canada and Mexico, as well as the USA. So again, that's a little bit of where that came from. So our vision, as outlined here, is a world where taste and smell are valued as essential to health, safety, and wellness. So all three of us as people who are impacted with anosmia ourselves understand how important smell and taste are in all of these areas of our lives. And one of our goals is to educate people, the broader public in particular, about how important they are. I know we've shared a little bit of stories today that we've all had moments in our lives where not having a sense of smell put us in a dangerous situation. For example, one day I was doing dishes and I was cooking behind me something on the stove. And I didn't realize that what I was cooking was literally on fire and in flames until the smoke alarm went off, because as a person who doesn't perceive smell, the smoke that was happening, I didn't see it and I didn't smell it. So the alarm went off and I turned around and was like, whoa, that's drastic. So I had to kind of deal with that situation. So we really do want people to be aware of how dangerous it can be. So in addition to things like a safety concern, there are also other concerns, and it has a great impact on a person's overall health and wellness, including mental health, which we want to take into consideration in the future as well. We want to raise awareness about how it can impact a person's mental health as well. So next up, I'm going to pass it along to Marj. Marj, you're muted.
Okay. I'm unmuted now. Just to piggyback for a second on what Katie said, it is interesting from a mental health perspective to think about how this impacts us and other people. One of the things that at this point I think is funny, but in the beginning I didn't think was very funny, when people would hear that I couldn't smell, they would come up to me with things that had a very strong odor and sort of stick them close to my nose and say, but you can smell this, right? Or try this, like if I tried harder or if the smell was really strong, somehow they could break through this sort of condition that no one really understood. Those are the kinds of things that, I mean, at this point I can kind of laugh about them, but in the beginning it was like, did you not hear what I said? Is there something, are we having a disconnect here? So one of the things in our mission is really to provide a voice, is to provide opportunities for people to get more information, find out what's going on. We want to advocate for funding because we feel like it's really important, and because it's just not at the forefront of people's thinking, and it needs to be. And so our job is to help push it closer to the front of people's consciousness. We're already collaborating with people living with the disorders, and we're reaching out to the communities of healthcare providers, nurses, institutions. I've just reached out to my ENT, who was a very nice man and knew nothing about it, and said to him, look, now you're going to learn something about it, because I'm going to send you all this stuff, and you've got the power of the delete button, but don't use it. Read the stuff. So, bordering on strident, but not quite there. Anyway, we're going to be collaborating with individuals. We're going to be working with people, and we want to partner with organizations around the world. Starting, of course, Monell has been hugely supportive, helpful, just wonderful. But we want to reach out to many organizations and just provide an advocacy group, a forum, a research element, and work toward funding and better understanding, better knowledge of the condition. Pamela, it's all yours.
Okay. So as we considered what this organization would look like and what resources it would provide, we reviewed the work of other like-minded organizations focused on taste and smell, and there are some incredible models who are years ahead of us that we could look at. We also looked at patient advocacy organizations for serving other illnesses, and then we looked really at the patient needs. And we identified gaps, and identified things that we can provide that aren't yet available, especially in North America. And we defined how we wanted to operate. We had long conversations over the past year of, who we wanted to be. And these core values represent that. Certainly to be patient-led and patient-focused is the central tenet to why we started STANA. We, as Marj talked about just before in our mission, we're focused on being collaborative, starting with this conversation today, which we hope will be the first of many to come. And we want to be in a position to raise funds for research and partner with you on research initiatives. So we're in the process of getting our 501c3 status and raising, raising funds, and we can't wait to be a fully nonprofit so that we can really be in the midst of that fundraising activity. Transparency is extremely important to us. We know that sharing evidence-based information and data is key for patients, researchers, and medical professionals. And it's wonderful that in the world of, that we all have Google and other resources, but it also can mean that there can be information that's shared that's not evidence-based. So we want to encourage truthful, fact-based information. But more than anything, we want STANA to be a program that's a safe place. As we've all talked about, finding a community has been so important to us. And so, the thing that's been interesting is we've been working on laying the groundwork for STANA over the past year. The numbers of people suffering from smell and taste loss has exploded globally due to COVID. And really what's been eye-opening and educational, certainly for me, but I think for others, has just been the patients sharing their stories, online and in the media. And what was previously an invisible disability has gained incredible visibility due to the patients' stories, and they're speaking out and searching for help, across all kinds of platforms. And it's shown that our voices, are much more powerful as a collective. So it's important that we will be a welcoming, empathetic, and compassionate organization. Really, no matter the cause. We know there's people who have been suffering since birth, others who have acquired it via illness or trauma. And really, no matter the time period, with so many of the COVID sufferers, they're experiencing temporary loss, and then others are permanent. And so with that, I'll turn it back to Katie.
Thanks, Pamela. So you all can see listed here some of the planned services and activities that we have in mind moving forward as a patient organization. So we really will serve as a patient resource for those in need of information in North America. And I think, to echo what Pamela said, it's really important that that information is evidence-based. If anyone has ever taken a wander over to some of the support groups on Facebook, they are fantastic resources for networking opportunities. But sometimes the information that's shared there may not be applicable to every person's situation, and people in need of information may not know that and may take that at face value. So we really want to provide things that are evidence-based and kind of vetted by experts for people who are looking for information. We will be providing a network for patients to get together by hosting informational sessions for those who have smell and taste disorders. And obviously in the current climate, we'll be starting off with these in a virtual setting, but in the future, when it's safe to do so again, we would really love to plan some regional activities for people to attend. Prior to COVID, on a personal basis, I am a part of some Facebook groups on for people who have anosmia. And I just messaged a few people, does anyone live in the New Jersey area? And would you like to go and get dinner and just meet each other? And from those, hosting those sessions, I met other people who have anosmia in person again and just had dinner. And that was really it. But it was fantastic to get to see people in person. So we hope to serve as a resource like that as well. Educational materials we think will be very important for healthcare providers. So we hope to provide those for those providers here in North America to reference when treating patients who have these types of disorders, because they may not know or understand the huge impact that it can have on a person's life. So that's something that's really important to us. We will also work to create a patient registry, which we can use to be used, in conjunction with research studies. So we do really want to further research on smell and taste disorders and how they impact people's lives. Any of the researchers who are on the call, I'm particularly interested in how having a smell disorder impacts your ability for memory. So if anyone wants to talk about that one in particular, I'd love to chat with you afterwards, because I think since I've become anosmic that my memory is horrible, but I don't know if that's true. And then lastly, we will be a patient platform. So we hope to serve as a platform, again, where we will advocate for research and provide a voice for patients, which is really what a lot of us want. We really just want to be heard. So next up, I believe I will be passing it along to Marj.
Okay, so here's where we are. We have just in the last couple of days reached our first financial goal, which was to have enough money to hire a lawyer to help us get our 501c3. And that may seem silly, but it was a huge goal for us, and we got there. We're real excited about it. We need to continue our fundraising, obviously, but hopefully in the short run, we will become a 501c3, which will make our fundraising at least legitimately easier for people. It'll give us a certain level of credibility that we hope that we have now, but we'll get it for sure. We are also at the moment, we have a website, which you're sort of looking at a couple of pages from. We are on Twitter at the STANA.org, and on Instagram. We have an Instagram live tomorrow. Katie will be hosting that. We're on LinkedIn. You can email us. Our GoFundMe page, notwithstanding the fact that we reached our first goal, is still open for all of you. The clock is running, so feel free to hurry in there and do something about that. So anyway, we are happy to answer your questions if we can. Thank you for sharing your time with us.
Thanks, everyone. I know that you all may have questions, and so I would open it to anyone on the call today to either raise their hand or unmute themselves to ask a question. Let's see, not everyone is racing to be the first one. Pamela, do you think you could put on the next slide, because STANA has actually framed a few questions for potential conversation today.
Jenifer, I'm sorry to interrupt you. It looks like Maureen had a question.
Oh, good. Maureen, do you want to go ahead and unmute yourself and ask?
Sure. Can you hear me okay?
Yes.
Okay. I'm sorry I missed the beginning. We had another meeting, but did you talk at all about the government sort of advocacy that you intend to take up, if any, and what your plans are?
So I can address that to start off. We talked a little bit about our goals and plans for what we hope to accomplish with STANA. Obviously, that is something that we would love to do, is to become advocates and get involved, where in particular, I know in the United States right now, from what I understand, there doesn't exist like an insurance code for a lot of treatments for people who have smell disorders. So in that realm, we would really love to serve as advocates in conjunction with governmental bodies to advocate for the importance of that and why that's needed and how that will help people who have smell and taste disorders get treatment. Obviously, if it's covered by insurance, then more people would be able to seek those services. So yes, that is a goal that we have in mind. We have some really great partners on board with us, in particular, people from the Monell Center and Polly Joseph, who's more familiar with like the National Institutes of Health and things like that, who are available to help us kind of navigate those issues as we get started. But that is something that we have had a conversation about before.
Also on the call today is Chuck Peterson. He's a member of Monell's International Advisory Council and has been very helpful in framing work specifically at the NIH to advocate for funds. Not to put you on the spot there, Chuck, but he has already met all of these folks in person. Hi, Chuck, how are you?
I'm good. How are you?
Good.
No, I'm thrilled this thing has come as far as it has, and well done, team. I actually joined both sides of this issue with COVID, and found myself unable to be the prime taster for Thanksgiving or Christmas because I lost my taste and smell. And I'm coming back, but quantifying these things and actually being able to help people chart their course, et cetera, is an ongoing goal. And so I hope to be able to contribute down the way a little bit in terms of those issues.
Fantastic. Thank you.
Well, we have this, we would like to pose this question for conversation. Monell co-hosted a conference in 2018. It was the identifying treatments for taste and smell disorders. Joel Mainland was one of the main organizers. We co-hosted it with two other groups, and the group has published a white paper outlining next steps. And one of the suggestions in the next steps was for more advocacy groups. And so STANA is now here in North America and will soon be incorporated. And they are eager to hear either today or in ongoing conversation with researchers how they can work with you to further the research. So I will open it for any comments today if anyone wants to. We have a quiet group today, don't we? That's quite all right. There will be plenty more room for conversation.
Jenifer, we did have some other questions that, maybe this one's not starting the conversation, but we had some other questions that we thought we would pose.
Good. Let's move on to them.
So let's move on and see if.
Yeah, so Katie mentioned this earlier about patient registries. And so STANA would love to know more about how patient registries can support researchers.
Can I just say, so I'm handling sort of the incoming mailing list, if you will. And one of the categories that we ask people is sort of what is their sort of baseline story. And I'm starting to categorize things as COVID, pre-COVID, different kind, anosmia, hyposmia, head injury, sinus surgery, those kinds of categories. And I'm wondering if there are particular categories that would be more useful to researchers, such that we can look at our beginning. It's not a big list yet. We're up to about 150 people, but before it gets too big, can we begin to stratify it in ways that might be useful for research purposes? And maybe not.
Well, let me go back as people are thinking about that. I see Polly put in the chat partnering with PCORI. PCORI spoke at our panel discussion last year, and PCORI does support patients as they develop as advocates, and they really support the partnership between patients and researchers. So that's a very strong possibility. Joel Mainland is suggesting in response to your question, Marj, congenital versus acquired, parosmia and phantasmia. Thank you,
I've
Joel.
actually got those categories, so that'll be good. Thank you.
Terrific.
Moving
Bye,
to
Nina. Nina has to run. Bye, Nina. Thanks for joining us. Happy Anosmia Awareness Day. All right, this is another question. What can STANA do to help build a bridge between researchers and physicians? And as people are thinking about that, Pamela, do you mind going over to the next one? And stories. So this is sort of where we started today, is the personal stories. So we know right now, and especially with COVID-related smell loss, that people's stories have been terribly important to collecting information. So STANA intends on collecting stories and would love to hear from researchers about how they could use those stories. And is there one more, Pamela? Yeah. So Duncan is still on, and we've mentioned Fifth Sense and Absent, really the two major organizations from which we all have learned so much. And so it is really intended, I think, for STANA to continue to partner globally and to be very globally based, while their own work will focus in North America. And so these are some of the questions that STANA is going to be exploring over the next 6 months and beyond as they get their 501c3 and get their name known more widely. So that is the end of the formal presentation, unless Katie, Pamela, and Marj, do you have anything else to add?
I think we have one more comment. Taste researcher in Colorado, Tom Finger, an important educational piece to help patients distinguish between smell loss and taste loss. Correct, yes. Okay, this is helpful. It's one of the things that we talk about. The different, because some of the people that are sort of joining us, a couple of them have said that they can't smell anything, but they can taste. And so we are looking at that, and hopefully we'll be able to be helpful on that front. Sorry to interrupt, Jennifer.
Oh, no, that's what we're here for. Yeah, thank you, Sue.
Oh, sorry. To add to what Marj was just saying, and to add to this point, one of the things that we think would be super helpful as an organization, again, is to provide some networking and educational opportunities for patients. And so one thing in particular for patients is really what is taste and what is smell, which seems maybe a little silly, but really to explore those in more depth for people. And in regards to this point, there is a difference between taste and flavor, and it's not a well understood difference. So I think when a lot of patients talk about they have no sense of taste, and they have no sense of smell, a lot of the times what they may be saying is that they have no sense of flavor. But maybe they really genuinely don't have a sense of taste at all either, which is a fascinating research question, I think, for a lot of the people who are here, is how could we collect these patients and then actually test them? I'm not a scientist, but I think that would be a cool research study. How do we test their sense of taste versus their ability to distinguish flavors, which I think is really cool, because then you could really identify what it is exactly that they're not sensing. Do they really have no sense of taste, or are they not perceiving flavors, if that makes sense? So yes, that is a great point. Thank you, Tom, for pointing that out.
It comes up all the time in all of the forums I see, is a potential confusion between what taste is and what flavor is. And perhaps taste loss due to COVID has blurred the lines a little bit, but it is clearly an important question. Hi, Chuck. Chuck posed this question: how does smell taste loss compare with blindness, deafness as related to quality of life? So that's a great question. The conference that Joel put together in 2018 was really focused on what we could learn from the other senses. And so Joel brought together researchers in these other senses to help people working on smell and taste loss learn from them. Joel, do you want to add anything to that? Sue is back. Are you looking at chemesthesis at all? Well,
Jenifer, sorry, before we move on to this question from Sue, I think Joel wants to talk about the previous question.
Thanks. Hi, Joel.
Yeah, hi. So Chuck was talking about doing some future research. So there's a apocryphal study that was done that some reporters have tried to track down in various ways, but was never published, where they tried to compare quality of life across different senses, right? Losing your sense of sight, sense of hearing, and sense of smell. And the rumor that I've heard is that if you look immediately after loss, that quality of life is ranked much lower for blindness and deafness. But if you look at 5 years out, it actually flips, and quality of life is much lower with loss of smell. But of course, it was never published. And so it's been sort of an intriguing thing in the field, and would be an interesting study to follow up on.
Thank you. So it's interesting, you know, of course, STANA will rely on the researchers to pose the research questions. And so, and maybe I should leave this to you, Katie or Marj or Pamela, to answer. You know, I think STANA probably stands ready to provide access to patients to answer many of these questions, and probably many more.
Yeah. Sorry to interrupt you earlier, Jenifer, but back, is it Sue Caldwell? Susan? So her question that she's asking us is about chemesthesis. And yes, we are aware of that as well as like a third factor to the whole group of smell and taste. But chemesthesis is actually really fascinating to me as well. And like the trigeminal nerve and how all of that functions together. We do have patients who talk about this as well. Personally, for myself, I when I first started smell training, after I learned about it, I was confused because the eucalyptus was doing something, but I couldn't tell you that I was smelling it. Like I couldn't smell the eucalyptus smell, if that makes sense, but it was definitely having an impact on me. The same thing with like, obviously like cleaning solvents and things like that. You can't be smelling or having those around you. They're still dangerous, even though I can't perceive the bleach smell. It's doing something.
How to discern them.
Yeah. So those things are really interesting too. And I've noticed a lot of people have questions about that in particular, is you can still perceive spicy, you can still perceive cold or minty, those types of things. But is that smelling? And I don't know. I don't know in particular. So that's definitely a good research question.
I've been turning flavor into a verb. Can I taste something? Can I flavor something? And it's hard. I mean, I think we all have our own individual definitions because everyone is somewhere on the spectrum of their ability to smell, flavor, taste, nothing. And then there's also the trigeminal nerve question where some things just show up and you wonder how they can. And you know, the eucalyptus for me was just the same kind of thing. I knew it was there. How?
So I'll just hop in here. So I'm Danny Reed. I'm here at Monell, and we're right in the middle of designing experiments to try to, through the National Institutes of Health, to try to understand like what are the heavy hitters in terms of problems that especially the newbies, the COVID-19ers are running into with their recent loss of smell and taste, and really just trying to get a handle on, should we be concentrating on food and nutrition, or should we be thinking more about quality of life, anxiety, depression, loss, that type of thing. So I really see a role for STANA in helping us formulate, you know, the most important questions as we try to examine sort of what's the experience like of these new folks. Not really a question, just a work in progress.
Thank you, Danny.
Can I ask why it's confined to the COVID patients and not the general population?
Well, there's some sort of political aspects of that, you know, but I do take your point that it might be an opportunity to open things up more broadly, but at the moment, that's where the dollars are.
I was going to say funding. Yeah. Okay, fair.
Hello, this is Gary Beecham from Monell Center. I want to follow up a little bit on what Danny just said, and to note that the most profound examples of pure taste loss are in patients with head and neck cancers who are treated with radiation. This often wipes out totally their ability to taste. And for these patients, they have then trouble eating. And it's actually a life-threatening issue. And I wonder whether it would be a good idea for people, for you to aim some of the STANA work at otolaryngologists who work on head and neck cancer, because there you would have some perhaps really profound patients that need help and certainly need support.
Thank you.
This is Chuck Peterson. One of the things that I think is coming to the fore is the ages and stages of smell loss and return, and the autonomic nervous system responses associated with that occur in tandem or perhaps via different pathways or whatever. But some people seem to note these fairly strongly, and I don't think there's any research done on that. And all your stories would impinge on that. So I think getting together a group of people who are open to participating in research in and of itself without a detailed questionnaire will be helpful. And I'd encourage you to do it.
Thank you.
Thank you. Any other questions?
Not in the chat so far. I think we've covered everything. Any other last thoughts?
It looks like there's a comment from Katie. We're so excited that you're here, Katie, and it's really great to have you on so you can learn more about the organization. And if you're not already, please visit our website and sign up for our email list so we can get connected with you and keep you posted for anything moving forward.
We so appreciate your time today. We just sent out our first newsletter. We're going to be sending one out quarterly. And so please keep up with us. Let us know what you think. Let us know what we can do. We're still young. We're still figuring things out. But the goal is to provide a really strong and pretty comprehensive scientific resource for North America. So thank you so much for your time today.
Thanks, everyone. Happy Anosmia Awareness Week. Tomorrow, again, is Anosmia Awareness Day, and there is a lot going on, primarily on social media. And you can join STANA at noon on Instagram to make a little bit of noise on Anosmia Awareness Day.
Thank you, guys. Thank you all so much for coming. It's really great to see you all. And if you have any questions, we'd love to talk to you.
Yep, I'm happy to help broker any conversations between researchers and STANA. So if there were questions that were not asked today, we will make sure that they can get discussed.
Thank you. Thank you, Jenifer.